what OCD really is and what it isn't. Hello, I'm a psychologist. If you're like most people, you probably think OCD looks something like this. I just love getting everything in the right order. Or maybe you've said something like, oh my gosh, I'm so OCD. I have to check my alarm 3 times before I can fall asleep. You've probably even heard someone say, yeah, I'm going to need you to be a bit more OCD about this. Okay? But let me be clear. None of that is actually OCD. What OCD actually looks like. So what does obsessive-compulsive disorder really look like? It looks far different, and far more serious, than organizing your bookshelf or triple-checking your alarm. Let's take a step back and put things in context. OCD affects a little over 1% of the population in any given year. That's significantly less common than most anxiety disorders. So statistically speaking, you probably don't have OCD. But maybe you're watching this because you think you might, or because someone you care about does. Despite its lower prevalence, OCD is a very serious condition. Around half of all people diagnosed with OCD experience severe impairment. That means even simple, everyday tasks, like using the restroom, replying to messages, going to school or work, or interacting with loved ones, can become exhausting, time-consuming, and deeply anxiety-provoking. Why casual comments matter. When we casually say, I'm so OCD, to refer to liking things neat or double-checking something, we unintentionally minimize the very real struggles faced by those with this condition. OCD is not a preference. It's not about being neat, clean, or meticulous. It's not even a personality quirk. OCD is a biologically rooted mental disorder. While we don't fully understand what causes it, we do know one thing for sure. It's not your fault. OCD typically begins in childhood and often intensifies during the teenage and young adult years. What's happening in the brain? The neuroscience behind OCD is complex, but here's a simplified version. The parts of the brain responsible for reward processing, error detection, movement, and memory don't communicate efficiently in someone with OCD. Their brain is wired to remain uncertain about whether a task is completed or not. Take a light switch, for example. When most people flip it off, their brain confirms the task is done and moves on. But someone with OCD might still feel anxious, unsure whether it was done properly. Their brain tries to rationalize that anxiety. Maybe some dust blocked the switch. What if I didn't turn it off all the way? What if that causes a fire and the whole house burns down? This is the brain trying to make sense of irrational anxiety by creating stories. In people with OCD, these stories become obsessions, recurring, intrusive thoughts or images that are difficult to dismiss. Understanding obsessions and compulsions. That brings us to the 2 key components of OCD. Obsessions and compulsions. Obsessions can include a wide range of distressing thoughts or images, such as fears of contamination, harm, or religious blasphemy. To cope with these obsessions, people with OCD perform compulsions. Repetitive actions like checking, cleaning, counting, or seeking reassurance to reduce their anxiety. These rituals provide temporary relief, but the anxiety always returns, restarting the cycle. The core of OCD, doubt. At the heart of OCD is doubt. People with OCD experience an overwhelming sense of uncertainty. Did I lock the door? Was that a bump in the road? Or did I hit someone? Did I touch something contaminated? Do I now have a deadly disease? Did I pray the right way? Or am I going to hell? This persistent doubt can spiral into compulsive rituals. Washing hands repeatedly, saying prayers in a specific sequence, or checking appliances multiple times, just to achieve a fleeting sense of rightness. As one of my patients once described OCD, it's the thief of time. It consumes hours of the day and can seep into every corner of life, making even the simplest tasks a challenge. Do you have OCD? Or is it something else? At this point, you might be wondering, do I have OCD? Here's something important. Most people experience odd, even disturbing thoughts from time to time. For example, when I lived in New York City, I occasionally had a thought like, it would be terrible if I accidentally fell onto the subway tracks. When my daughter was a newborn, I remember doing laundry and briefly thinking, what if I accidentally put her in the washing machine? During the early COVID pandemic, hearing someone cough made me think, did I just get infected? These thoughts are unpleasant, but they're not dangerous, and they don't mean you have OCD. The difference is that people with OCD get stuck on these thoughts. They become obsessions that consume more than an hour a day and are often paired with compulsive behaviors. If you're mostly worried about your job, health, finances, or relationships, you may be experiencing generalized anxiety disorder, GAD, which is different from OCD and treated differently. Is there hope for OCD? Absolutely. The good news is that OCD is treatable. There are effective medications, especially those that influence the serotonin system, similar to antidepressants but at higher doses. There's also cognitive behavioral therapy, CBT, specifically exposure and response prevention, ERP, which is considered the gold standard for OCD treatment. In ERP, you face the situations that trigger your obsessions without engaging in compulsions. Over time, your brain learns that the anxiety will eventually pass on its own. Because the brain is neuroplastic, it can change and adapt. With ERP, overactive brain circuits calm down and reconnect more effectively. For example, if your compulsion is to wash your hands 5 times, ERP might involve washing only 4 times, not washing at all, touching a contaminated surface and resisting the urge to cleanse. This therapy is often done once a week with a trained clinician. In severe cases, people may benefit from intensive outpatient, partial hospitalization, or inpatient care. Alternative approaches. Not everyone responds well to ERP, and that's okay. Other therapies include acceptance and commitment therapy, ACT, which helps you change your relationship with your thoughts and feelings rather than fighting them. Inference-based CBT, where you learn to deconstruct the false narratives that OCD creates. I'll explore these treatments in more detail in an upcoming video. Final thoughts. OCD is often misunderstood, minimized, or joked about, but it is a real, debilitating, and treatable condition. If you or someone you know struggles with OCD, know that help is available and recovery is possible. To learn more about how anxiety works and explore additional strategies for managing it, check out the next video right here.